Hello, I'm really excited to be sharing with y'all a method to take notes for the H&P. This is actually a method that my older brother passed on to me. This is something that he noticed medicine residents using while he was in his clerkship, and he passed it on to me. I've adopted it and then I've adapted it. So what are we talking about here? We're talking about a template that we can have on a piece of paper, and we'll go through it, a piece of paper that you can use to write your notes by hand. So who is this going to be more useful to? This is going to be useful for people starting medical school, people starting their clerkships. What we're doing here is we're exploring options of how to record information while we interview patients, right? That's part of that learning process. And I really think that this could be a great way for some of y'all to learn how to do that. So this can be applicable in the wards, while outpatient in your OSCEs, or the objective structured clinical examination. Even on Step 2 CS, and I used it throughout all of those, and it was very, very helpful for me, and I really hope it is for you too. The other thing that it can really help with, and that I found I grew by using it, was with presenting patients. So a huge portion of the way people are going to interpret your thinking process and how you're seeing your patient and what you know about your patient is through your oral presentations. That's a large part of the clerkship and the large part of how you earn a grade in your clerkship. I've noticed M2s, they've talked to me about how they would scour their papers for information as they try to present a patient, and this is a way to combat that. Another thing is that within the structure of how this paper is lined up, it's already inherent, this is how you will present. Because one of the things that you realize is, and a friend of mine put this most aptly, so he said, what we're really doing as we learn medicine is we're learning to speak a language and express a story in a certain language. And I think this really clicked for me during my emergency medicine rotation. So I was having a difficult time presenting patients. Even using this method, I was having a hard time going from hearing the patient's story and then presenting it in that medical way. And an attending just stopped me in the ED one day. He said, just tell me his story, Rodolfo. Just go through his story, tell me what the structure, but just tell me his story. And I found that to be really, really helpful. So this method, I think, if you combine it with telling the story, I think it can help you as well. So in all openness, there are some caveats to this method. One of them is that you will likely benefit more from it if you have smaller handwriting. That is one of the things that the space constrictions do call for. It's great for clinic, so I absolutely still use it to this day, since first day of medical school to now nearing my last days of medical school. And what we have here is I have the template here. We're going to go through it on the board behind me, and I'll have a PDF in the description, so make sure to check that out. And what I do is I have a master copy that I put in my printer and I scan it, and I have many, many copies of this just lying around ready to go when I go to clinic or wards, as it may be. So let me transition over to the board. Alright, let's get into it. So one of the great things about this method is that it's very minimalistic. So that means that you can recreate it in any template. You don't need to have that master sheet that I was referring to, churning out different copies of this, or the same copies of this, but you can get a blank piece of paper and recreate it just the same. The good thing about that is that you can use that on your OSCEs, you can use that on your Step 2 CS, and I use those for those settings. So, first thing to do on this is to just take a piece of paper and fold it in half. And that's what I have represented right here. This is a half of a paper, okay? In order to first start dividing the paper for this method, one of the first things you do is you just take a line, draw it right down the middle. Right down the middle, okay? And then you're going to leave this section blank. We're going to concentrate on this side. Divide it into imaginary 2/3, and you're going to go here. So you'll have a 1/3 here. I think my proportions are off, but that happens. And then you do in the middle of this, you draw a line. Okay? And now this section you divide into thirds. And within this middle section of those thirds that you just drew, you draw in right in the middle another line. And right next, staggered to this middle line, you draw one more line, and you can draw for some flair. You can put in some little boxes here, and we'll walk through what each of those mean. So starting out with this, you start out with the date. So we're at January 20-something, 28th, I think. And the next spot is identifying your patient. So I usually leave an M in the template, and you can see that in the PDF, and a dot. And so let's say it's Mr. Brown. Okay? And Mr. Brown is a how many year old male? So I leave a parentheses. I'll put a number here, and then year old male or female, as the case may be. I'll just draw it in. And then one thing that I learned as I started seeing the flow of the hospital, especially in the hospital more so than the clinic, would be code status. So I incorporated an area for code status here. Let's say this patient is full code, and I'll write it right here. So now every time that I approach the patient in the wards, and I didn't see a spot there, I would think, oh, okay, remind yourself to either look for it in the chart to see if it was already asked of the patient, or go out and ask the patient and have the resident verify it with you. Next part of this template is the MRN here, and that will be really important, especially as a medical student procuring different resources and records for those patients, especially if they're coming from an outside hospital and talking to other specialties. So now we have that. And a personal touch that I noted in the hospital is that not all patients are going to be coming from the home city, the city in which your hospital is based, right? So it's always a nice touch to know where the patient is from, and either you ask them or you find them in the chart. But I would put, Mr. Brown, and I'd put at Chicago, so I'd know that he's coming in from Chicago. So now you have your identifiers. Next part is the chief complaint. Now this is going to be very brief. I've been having belly pain for 3 days. That's what the patient said. All right, so you write in your CC, very brief. And now you move over to HPI. Now your HPI, I'm sure you're wondering this. This is not very much real estate to work with for your HPI. This is why I left this part of the paper blank, okay? So you're going to have your template here to be able to write kind of freestyle, but information that doesn't quite fit within these other sections that we'll go through, you can put in here. And that way you're not scouring your entire paper for different facts and different details of this patient's story. So you have your HPI here. And then remember how I was talking about how this can really help in oral presentations. And it's because it's already structured in a way that we're used to presenting. So let's go through that. We start out with the past medical history here. And past medical history is followed by past surgical history. And then we can ask about medications. And one good thing to remember is that not all patients will know their diagnoses in the medical vocabulary. So a lot of times you'll find out some of this information by asking their medications. And then at the bottom, medications, I added here a section for allergies. And you can write their allergies to the substance and then the specific reaction that they have. That's very important to note. And you can also put immunizations. That would be important for some adult patients, and especially important for pediatric patients. So now you have those, and you move on in thinking about how the structure of the interview is going, how the structure of your oral presentation will be. You go on to family history. And also social history. And now you see the pattern that is reinforced by this template. And of course you end your initial interview with a review of systems, and we can talk a little more in detail about that because there's some good things that to go through with that. And then for the more objective information, there will be the physical exam, the labs, and the imaging. And I like to put those here. And what this small real estate of paper forces me to do is to put in the most relevant ones, the most salient ones that I would want to bring attention to, that I want to remind myself. And now, the most important part of any patient encounter or patient presentation, I would argue, would be the assessment and plan, all right? So I've gathered your story, I've heard what you've experienced, what you're feeling, I've gathered some objective information. How are we going to help you, okay? That's where your assessment and plan is here. And again, you'll note not much room. Initially, I tried to put more details of my assessment and plan here, but I found that it was better to write more bullet points. So I'd do a problem-based plan in order of priority, so highest to lowest, And then as you get to know your patients, you find that you do not need to write out explicitly the details of each plan. But this bullet point method on this template really helps guide you, okay, I need to remember this problem and not to minimize it, but to keep it salient in your mind. And then to complete this whole thing, I wanted to mention how another way you can use this free space. So we talked about how you can use some of this space to write some kind of freestyle H&P notes, HPI notes, sorry. But you can also use this, especially while you're on the wards, to write your vitals and objective information for that day. So I'll write their vital signs, their CVC, BNP, and I'll have something in my hand, physical, that I can walk around with instead of having to rely to go to the computer for that information. So that's just another way to use this other side of that sheet.